a board member of the Center for Jewish Genetics. As a result of an article I published about a personal story. I had a sister with Tay-Sachs who was born around the time I was 8 years old. When she was about 8 months old, she was diagnosed with Tay-Sachs after my parents noticed that she wasn't really developing like a normal baby. And Mindy lived to be about 3.5 years old. Obviously, that had a huge impact on our family. When I was older, I definitely wanted to get genetic testing for myself so we could avoid something like this happening to one of my children. The ability to get Jewish genetic testing, for me, I'm not a carrier, so it created peace of mind that I could go forward and, have children. Had I tested positive, then we would have dealt with it and sought out some different options.
The Center for Jewish Genetics is the only nonprofit of its kind in the Midwest, and we focus on education and outreach for a panel of 19 Jewish genetic disorders. And we really make sure that every young adult in our demographic and community knows about this vital program.
I've spoken publicly, both in the synagogue and in other forum, a lot on what it means to be educated on the issue of Jewish genetic disorders, what it means personally for me, for my wife, for our family to be part of a carrier couple, what it means for our kids when they one day will know that they are both Tay-Sachs carriers, my son who is now 9 and my daughter who's 5.5.
The Center for Jewish Genetics also focuses on hereditary cancer outreach. Hereditary cancer is more prevalent within the Jewish community, so while we focus on awareness of the single gene disorders, it's also very important that the word is spread about hereditary cancer.
In individuals of Ashkenazi Jewish descent, they are 10 times more likely than the general population to have a hereditary predisposition to developing cancer. What we see in families that have this hereditary predisposition is cancer developing at earlier ages. So individuals having cancer in their 20s, their 30s, or even their 40s.
Young Jewish adults have such an increased risk for carrying genetic disorders or for hereditary cancers, and they're so busy thinking about today that they don't take the time to think about tomorrow. And part of being healthy today is being proactive about your health. Being healthy is about more than just eating right, it's about the whole picture, and genetic health is part of that.
My experience with carrier screening goes back to actually when my husband and I got married in 2011. I had known about the program and it was something I felt very strongly about doing. I ended up being a carrier for 2 disorders on the larger panel, not Jewish genetic disorders, and my husband was not a carrier for anything. So it was great because we felt like we were in the clear, which was great. We're good to go when it comes to the next step of starting a family.